website as soon as we can get it up, along with the video of this presentation. So in case you find it useful and you want to take it back to people in your office, it'll be posted. But if you want more direct, leave your email with Adrian or Katro, and they'll take your email and we'll email you the handouts and the link. Okay, so we're trying to make it easy for everybody to access the information. So as employers and providers of services to our clients and to the public, we all have a common goal of health and safety of our workforce and for people who are entering our premises. So we have that common goal. And I think, should I say this without being political, but the governor of the state of New York summed it up the best. He said,
Her. Pat, she said, move over.
The governor of New York said, we're having a health epidemic potentially, but we shouldn't have a pandemic of fear based on a lack of education, misinformation, or misguided policies. So the whole purpose of this is to provide people with sound information, and we're really lucky to have Louise Ng of Dentons USA LLP here. Louise is one of the legal icons of our profession. She's not only a terrific lawyer, she's always ranked nationally as a lawyer, as a litigator, as an expert, but also she's a leader in the bar itself. She's a past president of the HSBA, past president of the State Bar Foundation, and she's been on numerous boards, committees, and she's the chair of the Supreme Court's Wellbeing Task Force. In addition to private practice, leadership in the bar, Louise is also a community leader, and she's always been an ardent supporter and entertainer for the Child and Family Services fundraiser and the Pacific Buddhist Academy and too many other organizations. So we're real lucky to have Louise here with us. So
Good morning, everybody. Good morning. Well, thank you very much for coming early. I was just thinking that this was supposed to be a full house, and it's not. But I just think, for me, 8:30 is really a good idea until 8:30 rolls around on the day of. So thank you to the early birds. So let me tell you what we'll cover. And because we have a pretty small group, if you have questions along the way, feel free to ask them, and I'll try to repeat them for the audience that's listening in. Because it's good to know what is on people's minds and what's important. So first of all, let me just cover what we're going to cover today. We'll talk about travel, first of all, what employers should do about business travel, as well as personal travel. Also, how to handle employees who have recently traveled to countries that are subject to restrictions. And then the legal implications if an employee becomes infected with COVID-19, what leave laws and policies may apply, as well as how can employers be proactive and stay ahead of the game. And then if we have some time, just some big picture things. But the big picture things you can read about in the news, which is it's not just an HR and it's not just an employment issue. It really affects our state's economy and economies all over the world. And first of all, I guess the overriding theme is that you're going to be hearing a number of acronyms or alphabets coming up, starting with COVID-19. And here, I had put down a nerd quiz later on in the presentation, but does anybody know what the difference is between COVID-19 and SARS-CoV-2? Okay, so I just read this on the CDC website, but I used COVID-19 to refer to everything, the virus, the disease, but now they're starting to break down the terms. So COVID-19 refers to the disease you get from the coronavirus. The coronavirus itself is starting to be referred to as SARS-CoV-2. I'm not sure how to pronounce it, but anyways, it's SARS-CoV-2. And I guess it's a strain of the SARS virus. The other, for the overarching legal the laws that apply to this situation are probably OSHA, workplace safety, as well as ADA, Americans with Disability Act, and other disability laws. And then, of course, non-discrimination. That in a situation like this where there's a lot of fear and of the unknown, we have to be vigilant not to discriminate against particular groups. So first of all, we'll cover what to do about business travel to China, etc. And when I say China, etc., there's actually more countries. So if you go to the CDC's website, and what we're advising employers to do is to look, or everybody who has to make decisions about what to do, is to go on a regular basis to the CDC website, to the Department of Health, the State Department of Health website, because they have updates on what the latest and the greatest is. And in terms of an employer acting responsibly and legally, it will likely be tied to, okay, what are public health and government authorities saying in terms of restrictions, and then tailoring the employer's response to those restrictions. With respect to non-essential travel, when I first gave this presentation on last Thursday to SHRM, it was still an evolving situation. It changes every day. So it's like the day after our firm came out with our travel policy. And the ones that I've seen are pretty standard, which is that to avoid non-essential travel to restricted countries. What are restricted countries? Well, I'll get to that, but generally right now, the CDC has 3 levels of restriction, and the highest level, level 3, is China, South Korea, Italy, and Iran. And within that level 3, certain of those countries, China and Iran, I think, or South Korea. There's certain travelers there's restrictions against even allowing travelers into the U.S. And I think it relates to China and Iran, but we'll get to that later. The overarching issue or concern here is that OSHA has a general duty clause for employers, and that duty is to provide that employment and a place of employment are free from recognized hazards that are likely to cause death or serious physical harm to employees. So that is the thing to keep in mind, both in terms of dealing with employees who travel, employees who have been exposed or infected, as well as other employees in the workplace. OSHA itself has issued interim guidance for handling COVID-19, and I provide the link up under the OSHA website. The main thing to keep in mind is that to have employees avoid non-essential business travel to those restricted countries. Obviously, there are going to be exceptions, but those should require the clearance on a case-by-case basis of the employer. The employer should consider other options to travel, such as teleconferencing, remote working, video conferencing, and the like. Okay. So the next question arises is, can an employer require essential travel? What if it has this policy, but an employee refuses to go on a trip? What should an employer do? Well, in that situation, the 2 things to keep in mind are that, okay, the employer has essential business, but there are obligations under ADA as well as the general duty to keep the employee and the workplace safe. And so if an employee has an underlying health condition that the employee informs the employer of, then in this situation, it would be wise to figure out other accommodations to essential travel that the employee could be doing. And remote working and teleconferencing is probably the most obvious one. What I'm seeing now, the next level is, first there were policies coming out about restrictions and safety in the workplace, and now employers are coming out with making sure that everybody's remote capabilities works well, that they can work from home. I've heard the federal court is doing that in terms of making sure everybody has the IT capability to work from home. And we just got an email yesterday from our firm wanting to check. In fact, the other day, all of our phones started ringing at once because the firm was checking its communication system. So that's communication we'll get to is another important factor of being able to get information to employees quickly. And then with respect to employees who refuse or are very reluctant to do essential travel and claim a health condition, under the ADA scheme, it's just important to do very fact-specific, back and forth iterative process of working with them to determine what would be a reasonable accommodation to essential travel that they are reluctant to do. Now, the next question is, what about personal travel, especially now that this is spring break season, and I can't go to Canada for skiing this year because our firm has put limits on travel, or it's just good policy to kind of walk the talk. So generally, the employer probably does have more leeway to restrict employee personal travel. There have been recent federal cases in the 7th, 8th, and 11th federal circuits that uphold employer adverse action against employees who insisted on traveling to restricted areas. A case in point is the case that I put up there, EEOC versus STME, an 11th Circuit case in which an employee refused the employer's instructions and went ahead and traveled to Ghana in order to visit family. And Ghana was not an area where there was an Ebola outbreak, but neighboring countries had Ebola outbreaks. The employee consequently was fired. And after going through the whole court process, the courts upheld, or the 11th Circuit upheld, the employer's right to terminate the employee for traveling to a country whose neighbors had Ebola outbreaks, saying that the terms of the ADA protect persons who experience discrimination because of a current, past, or perceived liability, but not because of a potential future disability that a healthy person may experience later. But even then, care should be taken because the EC has, in the past, acted on potential future health condition as regarding an employee as disabled, so long as the condition otherwise qualifies as a disability under law, which is a fraught phrase with meaning, is that the person still would have to qualify with a disability and then be viewed as having a potential future health condition. One of the things that I'll give you also a link to in a future slide is that look to past resources, because the EEOC 11 years ago, back when H1N1 was a concern, actually came out with pandemic guidelines on dealing with pandemics. And it deals, there's a lot of discussion there about balancing the employer's interest in workplace safety versus the requirements under the Americans with Disability Act. So it still remains a good guidance for what to do in this situation, because agencies are still coming out with definitive guidance, and many those that do have have interim guides that do change on an almost daily basis. Let's see. Okay. So the next question is that if employees must or do travel to restricted areas, what to do? And just in general, for the workforce, as well as employees who are traveling, the important thing is to educate them on the risks. It not only protects the workplace, but it also shows that employers are concerned about employees protecting their well-being. So if an employee cannot avoid a business trip to a restricted country, make sure the employee understands the potential associated risks. The best source, again, for such guidance is to direct them to the CDC as well as our State Department of Health websites. And also just alert them that, even if they do travel, there could be disruptions in travel, delays, particularly if one is coming from China, South Korea, Iran, or Italy. I came back from Japan in mid-February, before all of this really started. And when I came through immigration, they did ask if I had been to China. They didn't check, but they did ask me that question. Um, so just be aware and make the employee aware that there could be delays in travel or extended questioning if they do come from restricted areas that could delay their travel plans. Important to provide relevant safety information, how the virus is transmitted, its symptoms, and how to avoid exposure, which I'm not going to get into here because I assume that that information is readily available and online. I give the site here for the CDC website that if you Google CDC and coronavirus, it will get you to it, and as well as the State Department of Health, which has information on its main webpage, as well as there's a branch of infectious disease that also has information. Let's see. I'm going. Okay. Okay, I wanted to show you this one. So along the lines of educating employees and oneself, both the CDC and our State Department of Health website have a page or a box where you can input your email if you want to be updated on the latest and greatest with respect to the virus. And so I provide the links up there. And we've already done our trivia quiz about what COVID-19 versus SARS-CoV-2 is. Okay, so the next precaution that employers can take when employees have traveled to restricted countries is to do health screenings. And health screenings, generally they're regulated by the ADA and restricted. And so the health screenings that an employer may require a returning employee to do should be carefully tailored to the situation, not only trying which countries have been deemed to be high-risk countries, but also be job-related. And so the first bullet point there is that if employees who have traveled to level 2 or 3 countries, level 3 being the highest, level 2, Japan is the only country right now in that category, make sure that if they require medical screenings, the exam is job-related and consistent with business necessity, which in general, I think business necessity these days is ensuring the health of the workplace, and so there's probably a heightened or expanded ability to require those screenings, and that the employee reasonably poses a direct threat to health or safety of him or herself or others that cannot be eliminated or reduced by reasonable accommodations. The general rule, I cite the general rule under the ADA too, which prohibits employers from making disability-related inquiries and requiring medical examinations unless, sort of the opposite of that, the employer can show it's job-related and the employer has a reasonable belief that the employee poses a direct threat to the workplace. Further on health screenings, an employer does not need to wait for symptoms to develop before asking an employee to get a health screening, because as we've all known and heard, the incubation period for the coronavirus can be long, anywhere from 2 to 14 days. The employer may inquire if the employee has traveled to a restricted country, and that is one designated by the CDC, and I'll go into those categories in the next slide. And then, as I mentioned, the employer should regularly check guidance from the CDC and other public health sites to determine the type of employee travel that it can act on. And then this goes throughout, but another important point to keep in mind is not to discriminate. And that means that questions about employee travel should be asked of all employees who travel, not restricted to, say, employees from a particular country or ethnic group. One of my colleagues had mentioned that when she was in a mainland airport, and she's Asian American, every time she sneezed or coughed, she felt like people were looking at her. Okay, so luckily here, we have a different situation, but I think that there is that heightened sensitivity, and so we all want to be aware, particularly in the workplace, that we aren't singling out particular groups. So I've talked about this a lot. And so what are the current CDC levels for countries? Again, I took this off the CDC website. They have a travel advisory page. I said levels 1, 2, 3, and 4. Actually, it seems like the way they call it is more like 3A and 3B. The lowest level is where there is a country or area that has a risk of limited community transmission. Right now, Hong Kong is the only country or region, jurisdiction on the list. And for that, the CDC advises avoiding non-essential travel. But that's just a sort of advisory cautionary thing. For level 2, that is where there has been sustained, meaning ongoing community transmission. Japan is on that in that category now as of last week, I think. And again, the caution there is to avoid non-essential travel. Although I know that people have been going for business, and of course, some probably have continued to go for personal travel as well. Level 3, those are the two. Level 3, sort of 3A and 3B, are the ones where there is a more serious risk. So level 3 is described as widespread sustained transmission. And for that level 3, actually I wonder if I got this, I think I may have gotten this reversed, yeah? Okay, so let me go back. And ignore, or you might have to correct my slide here, because I think when I was going in reverse order. So basically, level 1 is to practice the usual precautions at the destination. So Hong Kong, practice usual precautions. So sorry about that. Level 2, for the places like Japan, it's to consider postponing travel if you are an older adult or have chronic medical conditions. Okay, so what is an older adult? I'd say it's like over 60 these days, if not more. Yeah. And then it's level 3 is the one where the CDC cautions to avoid non-essential travel. And there are two categories of level 3. There's the widespread, I guess it's Italy and South Korea, where you should avoid non-essential travel. But for China and Iran, there is, in addition, sort of level 3B is the widespread sustained transmission, and there are restrictions on travel to the U.S. Okay, so what to do if, another step that employers are taken or well advised to take is that if an employee has traveled to a restricted country, to consider that they work remotely. And one of the things I thought about is that perhaps if your employees do travel during this period, maybe they should bring their laptop with them, just in case they do need to work remotely when they come back to Hawaii. But employers may legitimately require employees who have traveled to China, South Korea, and other level 3 and even level 2 countries to work from home until it is clear they are symptom-free, and the usual timeline for that that I'm seeing in policies is 14 days. And that's why I say have laptop, will travel, bring your laptop just in case you have to stay home. Look to the CDC and the Department of Health for guidance on the areas that warrant that special scrutiny. And then a question has arisen in presentations about, well, what do you do if your relative has traveled to those areas, a family member? Generally, per the CDC right now, for the moment, individuals who have been in close contact with someone exposed to coronavirus or with coronavirus may continue their daily activities so long as they are not showing symptoms. Although I think that these days, if someone actually comes down with coronavirus who's in your household, that the safe step is starting to be, that person should stay remote, work remotely as well for the incubation period. Even though there's no current CDC directive that employees who have traveled to affected areas should stay at home, but we're seeing more policies that employers are doing that just as they're just out of good precautions, as well as the OSHA duty, general duty to keep a safe workplace. So what happens if an employee actually does become ill with COVID-19? There are various leave laws and policies that may apply. There is, of course, the Federal Family Medical Leave Act, which entitles eligible employees, if you've worked at your employer a certain period of time, to take unpaid job protected leave for specified family and medical reasons, with continuation of group health insurance coverage. And then the Hawaii Family Leave Law also protects, allows employees, qualified employees, unpaid leave in order to care for family members having serious health conditions, not themselves, but for family members. Another advisory that I've seen in publications is also to encourage family, to encourage employees who face leave to try to take their paid time off first, so that it's not as big a imposition on them. There are, of course, ADA and state disability laws that where employees may be eligible for leave or other accommodations because of an underlying health condition. Workers' compensation laws may also come into play, not in every situation where an employee might contract the COVID-19 at work, but if an employee, the infection arose in the course of those employees' duties and scope of work, and due to conditions peculiar to one's job, such as health workers, folks that are working in hospitals, doctor's office, who become infected through patients. What about employees who fear infection? That's another question that employers and HR folks were interested in, is what do you do for employees there's no existing threat, but there is a fear that somebody has traveled to a restricted area, even an Air Force base, or a military base where there is a quarantine, what to do. And I think that what we'll talk about later is that the main precaution or step employers should take is communication and education. The better informed employees are, the better that protects the whole workplace. But just keep in mind that employees generally are not entitled to take statutory family leaves or to a reasonable accommodation in order to avoid getting sick. The exception would be where the employee has a pre-existing medical condition, which makes them susceptible to exposure to a contagious disease. And in that situation, the employer should look at reasonable accommodations. And again, the best source for educating employees is going to be what the latest is from the CDC and Department of Health. There may be an employee who just has sort of an irrational fear or just a stubborn fear of infection, and the best that can be done is just to document that you've take the steps and document that you've taken the steps to educate all your employees based on what's the available public health information, and at least for and make them feel like that, the employer is looking out for them and taking appropriate precautions.
That's a question.
Yes.
I don't know if you're going to get to it later, but if, say, an employee did contract it, would they be able to do TDI for time out? Since you talked about workman's comp for those in the,
Yes.
would that apply? Would they be able to?
So the question is whether if an employee actually were to become sick with coronavirus, could they use their TDI? And I believe the answer is yes, but I haven't looked at that issue specifically, and I think it probably depends on how long they've been out. Yeah. Workplace, let's see. Okay, the next question is what are workplace safety and prevention duties that an employer has to protect employees who have been infected, or protect other employees against employees who have been infected or exposed. And again, I go back to the general duty clause of OSHA to maintain a workplace that is free from recognized hazards. And one of the steps or the steps that employers are being advised to follow, and you're probably seeing this all over, is to reduce environmental hazards at work and to take sort of good safety precautions, which means that encouraging sick employees to stay at home or work from home, maybe even considering flexible work hours so that employees who have been exposed are coming into work at times where there are fewer employees or no employees at the workplace. Taking care to have a sanitary workplace, hand sanitizers, disinfection, even providing protective equipment and clothing. The new term that I've been hearing is social distancing, keeping enough of a distance. The general rule is that apparently the virus can spread through droplets in the air up to 6 feet. And so, one way is just keep your distance from people. Even the Department of Health website says, well, maybe no aloha kisses for the time being. I know that's a hard habit to break because I think a lot of us are just automatically doing that. But I noticed that one of the new ways of greeting in China, if one goes by Stephen Colbert's late night show, is that they are like tapping their feet together as opposed to their hands, which that sounds like a fun thing to try to do. Don't fall, don't get tripped up. And then, provide barriers when necessary to prevent employees from being exposed to each other, especially in a workplace where many are sort of this open room configuration. So maybe you want to, employees are working close together, maybe provide some sort of barrier between their work areas. Now I'm going to talk about working remotely. And this applies not just to employees who have traveled to restricted areas, but employees who have been infected with SARS, CoV-2, or probably even the family members in infected households. So the important point there is to send employees home who have symptoms of contagious, even if it is against the employee's wishes. That's with an asterisk because, of course, we're talking about businesses where employees can work remotely from home. There are many businesses, public-facing businesses, where employees have to be at work or they can't afford to stay home on unpaid leave. But in general, the precaution that is being advised is to have employees who have been infected or are sick work from home. And that may mean checking your sick leave policies, updating them to make sure that employees with symptoms of a potentially contagious illness are forbidden to report to work. And one way of making that, making them think in the bigger picture than just their own convenience is that, really we all should be thinking about the well-being of not just ourselves, but of our coworkers and the workplace. And so if we can focus employees and employers on just taking care that we have a safe workplace, that will hopefully everybody feel a responsibility to report illnesses and stay home when they need to. According to EEOC guidance, sending an employee home who displays symptoms of contagious illness would not violate ADA restrictions on disability-related actions because if the illness ultimately turns out to be a mild illness, then it would not have constituted a covered disability in the first place. If the illness does turn out to be severe and contagious, then the actions would be warranted under a direct threat analysis. Direct threat analysis being, if the employee poses a direct threat to the work environment, other employees, then more steps can be taken to, regulate that employee's conduct and work conditions. And that's also covered very well in the EEOC's guidance, pandemic guidance from, I think it was 2009, and I'll provide a link later on. Oh, here's another issue that has come up. And so employers are instituting more work from home policies. What about employees who just want to work from home in general? Maybe not for the COVID-19, but for other reasons. One of the advisories one of the pieces of advice that are being given to employers is that for a remote work policy, to make that specific, to couch in a way that it is specific to this COVID-19 threat, in order to avoid creating a precedent. And so that means having a policy that's in writing, that's carefully tailored. Other suggestions that I mentioned is that to require employees to exhaust their paid time off before allowing remote work, so that they just can't, if they're needed in the workplace, they just can't take remote work on just for their own convenience. And also, even to the extent allowed by law, to retain the right for employers to deny paid time off requests based on business need. Again, the important point is to tailor employer policies and actions to the business needs, risks, and the public health information that is available. Otherwise, employees could potentially assert claims for discrimination under ADA that they were not afforded work privileges or opportunities. And maybe the next thing we're going to see are more types of discrimination claims arising from employees who are not happy with the policies that the employers have instituted. So that's kind of an issue to watch as this outbreak develops. Some privacy and anti-discrimination considerations if an employee is infected with the SARS-CoV-2 virus. Handling coworker fears about infected employees or employees who have traveled. It's important to remember that the infected employee's privacy and protected health information needs to be respected. And so that means being very circumspect about what employer should say about another employee's health condition and why they are out. And also emphasizes a need just for having a policy and a practice of just keeping employees informed about maintaining a safe workplace in general, so that they are prepared, that they are exercising safety precautions already. And also assure any workers who are concerned about a coworker's illness, assure them that the employer is taking all reasonable steps to protect the work environment, as well as the employees who employees who have traveled or gotten infected. And I have seen that type of language reflected in company policies as well. One of the things that our office started doing, and this was on direction from our overall leadership, is that we have started closing the doors, not locking the doors, but closing the doors to our firm and posting notices outside that essentially say if you have traveled or transited through an infected area um, or are sick, to not to visit the office at this time. And so that that is something also to consider. It's just in order to avoid contact from infected persons. And I suspect that the questions have started to come up about what places of public accommodation or where public goes, what are they doing, and we may see more of that kind of cautionary signage just to make people aware that they need to kind of monitor their own health before going into a place where other people gather. The other advice that we're giving to employers is not to seek medical information or diagnosis from a sick employee or someone who's potentially infected, but do ask them to report any flu-like symptoms to supervisors. So again, you're asking them, to report to you on sort of the external symptoms that they're having, not delving into their protected medical information, because it is likely that because health workers have an obligation to report instances of the COVID-19, that they will be making reports to Department of Health or CDC, and then the employer will be contacted and then asked to perhaps asked to give some kind of notice, exercise precautions, and that would be a safer route in which to spread information to other employees than to expose a sick employee's privacy rights. Some things to keep in mind about record keeping and reporting requirements is that the OSHA does require certain employers, those with more than 10 employees, to keep a record of certain work-related illnesses and injuries on a designated form. OSHA has deemed the coronavirus to be a recordable illness when a worker is infected on the job. There is a regulatory exemption of that, work-related illness for recording, needing to record standard cold and flu illnesses. Certain employers also may be required to have reporting requirements under state and local law if they have a reasonable belief that a significant disease is present in the workforce. And again, that in Hawaii, that means that physicians, lab directors, healthcare providers have a duty to report infectious diseases, including COVID-19. And more information can be seen on the Department of Health Disease Outbreak Controls Division's website, which is at the bottom of the page. Okay. Another issue for employers is, okay, how can we be proactive in planning for this emergency, especially now that the state has declared a state of emergency, as you may have noted in the news or the headlines, which apparently also enables them to have access to federal funding. But the good news is that so far we have not had any reports of COVID virus infection in Hawaii. But in terms of planning for the future of what may well be inevitable, as I mentioned, it's important to, a good resource is the EEOC's guidance on pandemic preparedness, published in 2009, and I provide a link on that slide. A key question there is whether a particular outbreak rises to the level of a direct threat, and that depends on the severity of the illness. It's an interesting situation with the COVID-19 disease, because in most people, what is being found is that it is you have relatively mild symptoms, which is a great relief. But it is people who have who are older and who have compromised health conditions where it can be a real threat. And we're seeing that in Washington, where it's been in a senior living community where there have been a number of deaths. My mother lives in Kahalanui, and I noticed that they were having a town hall meeting about what to do about the coronavirus. And so I'll be curious to see what was discussed there. As I mentioned, another proactive step is to refer to the most up-to-date assessments by CDC as well as the Department of Health to determine the severity level of the illness and whether an employee who potentially has been exposed may be considered a direct threat. CDC is not categorizing COVID-19 as a pandemic and has not issued a heightened threat level for the U.S. Okay, dry throat. Although, if you read some news sources, I think World Health Organization as well has not deemed this a pandemic, but there is some talk that, gee, this has many of the signs of a pandemic. I guess the lucky thing being that at least for most people, the symptoms are mild. I think the rate of death right now, I read in articles, is way below 1%. So I guess we can hopefully be reassured with that. The other thing to keep in mind is that there's a lot of misinformation out there. And so it's best to go with the information in the public health sites as opposed to rumors or, home remedy information that you may find on the internet. Some of the home remedy rumors that someone pointed out in a prior presentation is that, okay, rubbing your skin with sesame oil will not prevent infection. Don't drink bleach. Apparently that was one suggestion given. So yeah, just be very careful of what you read on the internet. Obviously, another important step for employers to take to be proactive is to develop plans and policies. I mentioned the first bullet point on an outbreak or pandemic response plan. Actually, one of the early adopters of doing such a plan was a local company, Island Holdings, who shared their 2-pager, actually 2 to 3-pager pandemic response plan at the SHRM presentation last week. So I'll circulate this just for your information. I like it because it's just 2 pages. Maybe I can give you both these. Yeah, and it talks about pandemic response. We're not at pandemic response yet, but I think it's still a good piece to review just in general for the danger of a threatened outbreak response. Maybe is the way to put it. In addition to review or develop one's business continuity plan, in particular, that's sort of the plans you keep in place in order to keep your business going, even if a lot of people get sick or there are closures. And a key item there is just communication, making sure you have a good means of communicating with one's employees on the latest news. And that's why, as I mentioned, our phones rang all at once one day because they were testing the emergency calling network. Review leave policies. Consider making it clear that employees with symptoms of a potential contagious disease or illness must not report to work while they are sick. And also review other policies, such as any employee travel policies, or maybe starting an employee travel policies, work arrangements, use of personal protective gear. That was a news item last week on whether airlines were going to be allowing their employees to use masks like the flight attendants, as well as just as part of one's wellness policies, making sure that there are just good hygiene practices that employees are being advised to follow in the workplace. One of the cases I'll cite in addition to the policy by Island Holdings being circulated is that I took a look at what our firm issued on February 28th. And so sort of an example of that policy is that it mainly focused on travel. and advising employees to not to take non-essential travel. Actually, it was a broader restriction, so we were not to take any cross-border travel that was for a non-essential purpose. And I thought that also meant that if I came back from Canada, I'd have to stay home for 14 days, but not just stay home, work remotely for 14 days. But for our policy, that only applies to countries that are sort of in the high-risk area. My husband just did go to Canada, and he was asked what countries he had been in. And we had been in Japan, but because it was more than 14 days, they didn't give him any further questioning. But again, situations could change because you might be in a country where there may be border closings or cancellation of flights, and so that is the danger of traveling at this point. Our travel restriction applies for the month of March. We don't know. I guess we'll be seeing later in the month what happens with companies and whether they're going to extend those restrictions or not. One of the other steps that our firm did, besides limiting non-essential travel, and of course there are exceptions, that there is case-by-case clearance. I don't know if they, you could also address personal travel and again advise employees to be cautious about personal travel at this time. Yes.
Does your firm discuss what non-essential and essential travel is?
There's not been a specific definition, but I think generally it's, essential travel being if you have, you have a business reason to be there, that business requires you to be there. And I suppose that if there, one of the things we're supposed to be reporting our travel plans. So I guess if there's any questions, the firm is going to be looking at, well, how important is this that you meet with the client or go to a meeting abroad as opposed to participating remotely. So yeah, a lot of this is subject to interpretation and just common sense at this point. Another thing that our firm has done is to form I call it a strike force, but it's more like a special services team. So within each of our practice groups, we have a work group, small work group that's supposed to come out with a thought leader type of information or just address questions that people may have coming in from clients. And we have a pandemic special services team that has been designed across practice groups in order to address client concerns and inquiries. And so because Sherm asked me to do this presentation early before a lot of, it was still an early stage, I'm on that committee. So I'll be getting a lot of emails because I also signed up for the emails from CDC and Department of Health. But it also it's good because the more information that we can get out to clients and to our firms, the less that there will be speculation or fears. We hope. The other thing that has been set up is an internal response team. So in addition to this sort of external team of special services team, we have a management group that's dealing with internal policies on how what kind of response to this outbreak should be had. And the most recent one, as I mentioned yesterday, came in of just making sure that everybody has checked their online or remote IT capabilities. And making sure the firm has the remote IT capabilities as well. And then, as I mentioned, the firm has started posting public notices on our elevator lobby and doors, just advising people that if they have traveled or are infected, to avoid visiting at this point. As I mentioned before, another proactive step is communication and education. As one HR person put it, sharing is caring. Making people and employees feel like they are being looked after and informed and educated and watched out for. And so important to inform and educate the workforce ahead of an out or health emergency. As I mentioned before, what you don't want to do is to create a panic by not educating and then only having that come up if someone got sick, and then there's a lot of speculation about what happened to that person. And so one of the suggestions is that there is a question and answer sheet that CDC has online that can be posted, or a link provided to employees. I noticed that even in the elevators and posted here, the building has put up a one-pager that gives a lot of basic information about health precautions, travel precautions, and sources to go to. And so you'll be seeing more of that. And then also just communicate about wellness policies and practices, good hygiene, precautions, just general protection against seasonal flu, because the general wisdom is that even the flu itself, let alone COVID-19, can lead to serious illness or even death. And then also to develop a process for return to work for employees who have traveled or have traveled to high-risk areas. Another thing to keep in mind is cybersecurity. This might be a time when scammers and fishers are taking advantage of the heightened awareness and concern about the COVID-19 and just sending fake emails about with false information or infected links about the virus. So just make sure that people are aware that if they do need to check, the best source again is the public health resources on to learn about what to do. I'm just going to touch on these special situations because I don't have the answers, but I know that these issues are, as we sort of deal with the broad outlines, the special situations that are arising have to do with high volume businesses who have a lot of contact with the public. And actually, the CDC has issued some interim guidance, for instance, for airlines and airline crew on reporting sick passengers, cleaning precautions, and the like. Nothing yet for, say, restaurants or hotels, but that's something to keep a watch for. What about businesses, like those that I mentioned, of employees that need to be present? Still an issue that's evolving, but not everybody can work remotely, and so again, it's important for those employees to just make sure that they are aware of what good precautions in the workplace, and do report if they do get sick. Again, healthcare workers do have specific guidance. There's an interim infection prevention and control recommendations for patients that have been confirmed with coronavirus. That's available. I didn't put in the links. It was a super long link, but I think that came from CDC as well. And there are various OSHA requirements for healthcare workers. I mentioned ALICE employees. Those are employees who are asset limited, basically are paycheck to paycheck. There was a concern that for those employees, they can't afford to stay home, especially if it's unpaid time off that they have otherwise. And so there needs to be perhaps extra precautions or leeway in such situations. At SHRM, there was discussion about, do you perhaps extend your paid sick leave policies just to encourage people to stay home when they need to, or even have sick leave banks where employees can consolidate their leave, and it can be used as needed for employees in need. I have a couple of slides about the big picture issues, only to point out that this really goes beyond just what happens in the workplace. Even the accounting, the SEC came out with statements about dealing with businesses, because so many of them are dependent on manufacturing or supply chains in China. I've noticed in today's paper, that is causing business to look at whether they really need to diversify where they're doing their manufacturing or getting their supplies, so that companies in the future are not so dependent on China or any one country that could be subject to risk. But I would say 2 weeks ago, when we had a women corporate directors event, and one of the directors mentioned that her big fear was this COVID-19 and how that would affect financial performance and thus indirectly employee retention, benefits, and the like. And at that time, it was kind of an abstract discussion, and then probably the next day, we started seeing headlines about the effect on Hawaii's economy, the stock market taking big dips, and the like. So again, just an issue that is of broad concern, and also to Hawaii's economy as well. The takeaways, again, just be vigilant, check the public health information sites, resources, but do not panic or overreact. And this is a time to plan in advance, revisit policies to make sure that there is, employers are prepared, and then communicate, educate, coordinate. Make sure that have the workplace is starting to issue policies on travel, remote work, IT support, workplace hygiene, what to do about visitors, and have an emergency communication plan. Just remember the legal compliance are the main ones being OSHA, ADA, non-discrimination, and privacy and protected health information. Important to document. That relates not just to making sure your policies are on remote work are specific to this situation, but if there has been education given to employees, have a good record of what has been done, especially if there are employees who have continuing fears. You want a good documentation that you have taken care to educate the workforce. And then, of course, the pitch for lawyers is that every situation is different and tailored. We can give general overviews, but if employers have specific questions, best that they get some tailored legal advice. So thank you very much for your time. Are there any questions or comments at this point? Issues that are burning issues in your workplaces? I know that a burning issue that came up yesterday was what courts were doing about this, and how do you handle outside counsel who travel in from affected areas? Should there be more phone participation allowed and the like? So anyway, those those issues are going to be coming up, I'm sure. Any comments or questions? Yes.
One clarification: when you were speaking about balancing employee privacy rights with employers' need to have an OSHA-safe environment.
Yes.
When you were saying about just once a employee were to be diagnosed, were you saying that diagnosis is not allowed to be broadly given to the rest of the workplace, but rather, I'm just trying to kind of delve into this a tiny bit. That was a little confusing to me.
Okay. So the question had to do with the countervailing considerations of keeping the workplace safe and educating employees versus what's protected health information, how much can you delve, how much can you share about an employee. And the general HR advice is that you don't want to discuss on a company-wide basis why an employee is out, what they're sick with, because it does violate their privacy. We have laws protecting against exposure of protected health information. And so I think just instinctively there's going to be that desire to share that information and to make sure that the employee isn't sicker than just the flu. But the general advice being given is it's that information is going to get from their healthcare worker. If they've been diagnosed, their doctor or clinic has a duty to report to the Department of Health, and Department of Health will be reaching out. We hope.
Let it go up.
Yeah, let it go up, and then you can
across.
come down,
right.
and follow the instructions of the Department of Health.
Thank you for that clarification.
Yes.
You mentioned the courts, and we're from the judiciary. We just wanted to let you know that we met with the chief judges yesterday, and they all said that they're going to be honoring requests for appearing telephonically more liberally during this, especially for civil cases.
Oh, great.
During this problem.
Okay. Well, that's great to know. And so if
Issuing some sort of
we'll be reading about it. Yeah, I know something came out on juries and reporting to jury duty just recently. But in case the people listening in didn't hear, the courts have met with the judiciary has met with the Chief Justice, and there's going to be a policy of being more allowing telephone participation for court appearances during this situation. So that's great to hear. And we'll be hearing more about that from the courts. Any other questions or comments? Thank you very much for coming, and best wishes. We will be emailing this. You know how to find me on the SBA's directory. I think I also have some contact info. Yeah, there it is. So if you have questions, there's my contact information. Best wishes and stay well, everybody.
Thank you, Louise.